right, good morning. My name is Cooper Root. I'm a second-year medical student at the University of Kansas. And I'm going to talk to you today about MRI findings of core muscle injuries. To start, core muscle injury describes any pathology affecting the musculoskeletal anatomy of the lower abdomen, pelvis, proximal adductors without any evidence of true hernia. MRI is suggested for diagnosis, but the reliability is inconclusive. Congruent nomenclature is very lacking. So ultimately, we conducted a systematic review to assess the evidence of MRI findings with core muscle injury to allow for more accurate diagnosis and treatment. Do you want me to keep going?
Yes, you can keep going.
Sweet. Yeah, so the following databases were searched using the PRISMA guidelines in April of 2022. Inclusion criteria included any studies focusing on incidence, clinical correlation, reliability, intertester, inter-rater reliability, as well as return to play. And we left out any studies regarding treatment or other imaging modalities, such as ultrasound. Ultrasound's used quite a bit in core muscle injury treatment, as well as diagnosis. So total of 1,912 studies were identified. 23 of these met the inclusion criteria. 15 of these studies assessed the pubic symphysis, 17 assessed adductors, 12 assessed the abdominal wall, and 6 assessed the hip flexors. Those were the most common anatomic locations that were included. The 3 most common findings were bone marrow edema at the pubic symphysis, adductor longus lesions, and rectus abdominis lesions. Definition of lesion differed quite a bit depending on the study. The evidence of core muscle injury on MRI ranged from about 5% to 23% in asymptomatic patients that were included in these studies as well. And one of the most interesting findings was that adductor enthesopathy on MRI showed a significant increase in the duration of symptoms compared to symptomatic patients without adductor enthesopathy. So as you can see, 24 weeks versus 6 weeks was the difference depending on MRI evidence in symptomatic patients. So ultimately, there is no consistent definition of pathologic CMI. Based on the various definitions, muscular groups included, sequences and grading systems that were utilized. MRI is a very useful tool in determining the presence or extent of CMI, but it needs to be considered alongside clinical presentation. As mentioned before, there's a large finding of core muscle injury evidence in asymptomatic patients as well. An MRI is useful in assessing the extent of the injury. We can give a more accurate time frame for athletes trying to return to their previous level of activity. So in conclusion, understanding the variable MRI findings associated with CMI allows expedited and specific diagnosis of these increasingly recognized pathology, assisting with accurate estimated times for return to play. Thank you very much. And if you have any questions, my email is included.